Ladies and gentlemen,
this is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports.
Here is your special host, the Senior Technical Advisor for Keating Dental Arts, Brandon Fetters.
Hi everybody, Brandon here. Welcome to another episode of the Dental Up Podcast. Our guest this week is a graduate from the New York University College of Dentistry, where she received her doctorate of dental surgery. Later, she completed a postgraduate residency at the North Shore Residency Hospital in Manhasset, New York. She is certified by the Alamin Deli Pieri Center in the practice of Biomimetic Dentistry. Currently practicing from New York, New York, please welcome Dr. Lauren Becker, DDS PC. How's it going, Dr. Becker?
It's going great. It's Friday, gearing up for the weekend. How's it going with you?
Oh, same. Definitely excited for the weekend.
I hear that. Do you have to work?
No, actually headed out of town this weekend, so, actually I might be lying. I might be in on Sunday, but that's, you got to do what you got to do,
Do you
right?
ever really stop working, right?
Yeah, no doubt. So I'm going to go ahead and just jump right in on this. At what point in time in your life did you get attracted to doing dentistry and decide that that's the career you wanted to pick?
So, just like every, mid teenager, I went to get my braces put on, and I visited the orthodontist with my mom, who would come over every 6 weeks for 5 minutes and say, "Looks good, come back in 6 weeks." Mm-hmm. And he had 10 chairs and, lined up, and it was just bang, bang, bang. And $6,000 a pop. And I thought, wow, this is really smart. This guy must make so much money. This is what I'm going to do when I grow up. Joke was on me. But I always follow through with what I say I'm going to do. So next thing I knew, I was, applying to dental school 10 years later.
That's really interesting. Now, speaking of which, where did you end up attending school?
So I went to NY Attentive, a place I swore I would never go back to. And then went back for some follow-up 2-year implant program a couple of years back. It was a great education.
That's excellent.
I should re-record that.
Yeah, you want to? You ready? Yeah, so you don't want to bash the school too badly.
I hated it. You could leave it. It's fine. It's the truth.
You sure?
Yeah, why not?
Okay, I like that. I like the brutal honesty. Now, when you went out into the field, did you start as an associate, or did you start with your own practice right off the bat?
In New York, the regulations are you have to do a residency or a GPR after dental school in order to go into private practice. So I did a year of residency at North Shore University Hospital in Long Island, which is a very well-respected residency program. And from there, I met my first mentor. There have been many, mentor turned, ex-bosses, who was building a new office in Manhattan. And he asked if I wanted to go work in his new practice, kind of as you'll have your own practice. I'm not going to give you any patients, see what you can do, and go from there. And for me, it was, a no-lose situation. If I didn't make any money, it was on me. But if I did and I succeeded, great. So I went directly into that as an associate. Well, depends whose lawyer you ask, but as an associate for 3 days a week there. And then I worked in a mill type practice, heavy patient flow, multiple insurance practice, 2 days a week to kind of supplement my income while my baby grew. I was at that first office for about 5 years. Like most associates, I could probably teach a class on what not to do straight out of dental school. First thing is don't sign any contracts without having a dental attorney read it. A regular attorney is not good enough. I worked there for 5 years, but had a pretty brutal restrictive covenant in Manhattan, which basically put me out of business from river to river, anywhere in Manhattan. So after fighting that and getting some relief, I moved 21 blocks and started working as an associate in another office where I was for 2 years till I finally realized I could do this by myself. I'm ready to go. And just last September, I went out on my own and started up my own practice.
Very nice. Yeah, that's some good advice there for dentists coming into the field, like you're saying with the a dental lawyer or a lawyer who specializes in dental. That's any other tidbits you'd have for dentists coming into the field?
When I was going out on my own, which is very scary, especially in an oversaturated market like I am, like New York City, I turned to a friend of mine who's opened a bunch of restaurants that are all wildly successful. And I said to her, how do you keep doing it? Like, how do you keep hitting home runs? And she said, find your North Star, pick what your vision is and what's important to you for your practice. And don't ever lose sight of that, and keep that in mind with every choice you make. Does this fit into my vision? Does this take me to the place where I need to go? And I think that was like the most eye-opening advice that anybody gave me. I've had previous bosses tell me that I was a glorified hygienist and I would never make any money just doing cleanings all day long. So, a little bit of, I can't think of the name of the show right now, but don't let the bastards grind you down. I mean, there's a lot of people who try to tell you in dentistry that you're not good enough or you're not as good as they are, where we should be supporting each other as dentists and helping each other learn and grow. So, The Handmaid's Tale, that's what it's from. Sorry. It's Friday. That's how my brain works backwards.
I feel you. Yeah, but no doubt that criticism a lot of times can make us push further.
Keep that North Star vision and keep pushing for what you deserve. It'll happen when the time is meant to be. Everything happens. It all works out as long as you keep focused on that North Star.
Yeah. It's almost like the preparation meets opportunity.
Yeah, exactly.
Now, in doing your practice, is there a certain procedure that you really prefer or enjoy more than, say, others?
I love to do extractions because it's like the only, obviously with everything in dentistry, there's always possible complications, and especially with extractions, but it's the only guaranteed I'm going to win, right? The tooth has got to come out. I'm going to get it out. So I've gotten particularly adept at taking teeth out, as my assistant says, they jump out of the mouth when the elevator goes in. And I love to do surgery. If you didn't have to marry the hospital for 4 years, I would have gone back and done that, but too late. I'm tired.
Not afraid of any hooked roots when it comes to your practice, I take it.
Yeah. Well, you know what? Sometimes the challenge, you learn from the challenges, right? You either you win or you learn. So even the hard hooked roots and things like that, they teach you what not to do the next time, right?
Yeah.
At the expense of the patient, don't tell them. But it's every challenge is a lesson learned.
Gotcha. Now, is there any latest piece of equipment or technology that you've incorporated into your practice that's been beneficial?
So we just registered our 3-shape. Mm-hmm. I have yet to use it. The first patient we went to use it on, I got locked out of the login screen. I was like, here's our new technology. You don't have to take impressions anymore. And then we had to take an impression anyway. But we're definitely trying to move more towards the digital, scanning field, which we're not fully there yet. I do have a CEREC in my office. I don't use it because I'm not fully there 100% with the quality, or at least in my hands. If it works in somebody else's hands, that's wonderful. But I still like a good old-fashioned crown being made in a lab sometimes, or all the time.
Yeah. You can't quite match that quality a lot of times with those in-office restorations versus what the laboratory can produce.
Right. I think we're getting there, and I think a lot of that also has to do with your skill as a clinician, how you can design and manipulate the software. Me personally, I'm not there yet, and I'm not comfortable with it yet. So, not saying I won't get there, but just right now, it's the time it would take for me to do that doesn't, it's easier for me to outsource it.
Yeah, I can understand. Now, in since you opened your own practice and growing that, have you utilized what type of marketing strategies have you been utilizing?
I've always, prided myself on trying to be as organic as possible, with no SEO or paid. We obviously pay for marketing in that I give out things to my patients, but I don't pay for SEO or Google search ads or Yelp ads. And part of the reason being is because I'm a fee-for-service practice. Mm-hmm. And a lot of the times when patients are searching, dentist near me or dentist who takes my insurance, you're getting those clicks, but they're not materializing into patients because we're an out-of-network provider. So we've really, that's been one of the most prideful parts of my baby, which started as a 3-day a week, nothing, and turned into now a 4-day a week, 4-day hygiene office, which, is over time was really incredible for me to watch. And it's just the beginning, but, we do a lot of fun, kind of edgier, millennial grabbing marketing. Like we use some tote bags. One has a picture of Beyonce in it, and it has play on some of her lyrics, or Jay-Z brushing his teeth, and it says, "Ladies is pimps too, go on, brush your molars off." We try to stay current on. We had one for The Handmaid's Tale. We did one for Game of Thrones, and we just really had fun having organic growth that way with our marketing like that, and having patients or strangers see our stuff and grow that way.
That's pretty interesting. I like that approach. That's different. I haven't heard that before.
And also, my team and I have been together for a long time. They haven't always been my personal staff, but we've worked together for 9 years. Mm-hmm. And we always talk about, providing the best experience for a patient from the second they make that first phone call or the second they send that first email on thinking joining the practice, all the way through, leaving and their follow-up, or if they have to have an injection, every patient gets a text message. So it's the attention to detail, and I think the patients recognize that, and then they say, "Oh, wow, my dentist texted me to see how I'm feeling," and then they're more likely to tell their friends. There's so many dentists in New York City that, it's the little things that you have to do to set yourself apart.
Yeah, that's very personable. Doing that extra touch, that goes a long way.
Yeah, absolutely. Except for when they text you on the weekends. Then it bites you in the butt.
Pros and cons to everything, right?
Yeah, exactly.
Now, when it comes to dental conventions or society meetings, do you often attend?
So, since going out on my own, I really try to stay, more on the forefront of my education. As I mentioned, I did a 2-year implant fellowship at NYU. Mm-hmm. This past March, I was in Dallas at the Biomimetic conference. I am going to the Dental Influencers Alliance conference in December. Have you guys heard of it?
I'm not familiar with that one, honestly.
Oh, all the cool kids are going. I'm just kidding.
That's probably why I didn't get the invite.
It's a lot of the Instagram, popular Instagram dentists that you see, and they really tried to pack it with great speakers. And instead of sitting in a lecture all day and making it boring, they've made it kind of more TED Talk style, shorter lectures, some hands-on breakaway sessions, and they've got some great speakers lined up, and it's definitely moving more from your old white-haired man club, to a younger, fresher. They need more women, but we're getting our voices out there, but definitely moving more towards that kind of feel. And I am taking my first COIS class in January, which is exciting / scary, because I've heard they're very addicting and it's not so bank account friendly. But supposedly they're, they're really eye-opening on how you, and revolutionary on how you practice. So I'm really looking forward to that.
Yeah, that's exciting. And I like the comments you made about the hands-on, because I've always found that, even for me personally, that really doing it is one of the best ways of learning. So that's definitely
the only way,
nice.
right?
Right. And it's just seems like you retain the information so much better when you're doing it yourself. Just like you said about early on in the practice, learning what not to do, almost in that same idea.
Yeah, absolutely.
Let's see here. It looks like I got a couple bonus questions here for you. With many states allowing the usage of THC and CBD oil for medical use, what are your thoughts on this in dentistry?
So I have really incorporated CBD into my practice on a large scale, without researching the legality of it. Edit that part out. I'm just kidding. I have a patient who was just, grinding through his night guard, couldn't, did the Botox, didn't work, had a sleep study, doesn't have sleep apnea, and just was breaking night guard after night guard after night guard. And I was like, why don't you just smoke some pot? And then I was like, oh my God, like the thought came out of my head it came out of my mouth before I had like the time to process that you can't tell patients to do something illegal. I'm like, no. And then when I was like, wait, you should get some CBD. And it was like a light, like in the cartoon, like the light bulb exploded over my head. And I was like, this has so many applications in the dental world, and it's not being used by anybody. And, or at least when I was, first thought of the idea. And then maybe a month or two later, on the cover of Dentistry Today was like a huge cannabis leaf. And I was like, damn it, I'm too late. I this is my big idea. And the whole article was about like how to educate your patients not to smoke pot. And I was like, no, like wrong way of thinking. You're looking at this the wrong way. I was a little excited, like you, I could still do my idea. But I mean, it's anti-inflammatory and it's anti-anxiolytic. Like those are the two main causes of pain and fear in our profession. So why wouldn't we, find appropriate applications for it? I mean, for clenching and grinding, for patients that are scared, for taking it before a procedure sublingually to prevent, post-op pain from inflammation. There's just so many ways you can use it, I mean, I'm sure I'm too late to this game, but I'm sure there's CBD toothpaste already, because there's CBD mascara at this point, which, why do you need your eyelashes to be relaxed, is beyond me. But, it just has so many uses. And with, the legalization of marijuana around the corner in a lot of things, you're going to see it widespread. I mean, I sell it to my patients, I'd say at least 10 times a week.
Yeah, because I mean, like you were saying about the CBD nationwide, and it's really, I mean, I think we all know somebody who's really seeing great benefits from using those oils.
Oh, it's wonderful. Helps you fall asleep at night. I mean, it's great. Patients, when they're a lot of fear also at the dentist's office is psychosomatic. So if I give a patient a CBD pill, that's not kicking in for 30 to 45 minutes, but in their minds, they're more relaxed because they've taken the CBD. So whether it's placebo effect or it's really working, my patients have had huge success with it.
Yeah, it's not just snake oil; it actually works. Now, in your website, you mentioned Biomimetic Dentistry. What inspired you to go on this route?
So, ironically, the first practice that I was working in, the person that I was working for said, "I'm going to this conference, or I'm taking this course. It's a holistic type of dentistry." And I was like, okay. And he's like, and you have to take it. And it was $3,000. And I was like, very much like maybe 1 or 2 years out of residency, we're spending $3,000 on continuing education seemed like the most bananas thing I'd ever done in my entire life. And I live in an apartment that's, well beyond what people pay for an entire year. So I like, even still with spending way too much money to do everything, I was like, I'm not spending $3,000 to take a course. Biomimetic Dentistry, if you're familiar or not, is a very conservative, approach to dentistry that allows us to only take out the affected caries tooth, but also preserve what's left. So instead of putting a crown on a tooth where you're missing 3/4 of a tooth, we can successfully bond either an onlay or an inlay or even just a composite restoration conservatively and protect the healthy tooth structure that's left. It also helps prevent root canals because the literature proves with 40-year-old literature that there are zones that you can, if you have 3 millimeters of clean peripheral tooth structure, that you can deactivate the matrix metalloproteases in the bacteria and keep them where they are so that they can't travel down to the pulp any further. Mm-hmm. And so you're doing a major service for patients who normally get, a crown on every tooth, and you're able to do either just a simple resin filling or an inlay and onlay and save them 3/4 of that tooth for, at this point I have 7 or 8 year success rate. It's incredible.
Yeah, that's awesome. Almost in the layman's terms, when I first came into the field, as it was put toward me, keep your stock parts as long as possible.
Exactly. And it's a very challenging. The insurance companies make that challenging, which obviously is not ethical. But you're dealing with a lot of people who, are taught, okay, this tooth is cracked, this tooth is missing 3/4, root canal, crown, and root canal post crown. Where this is the complete opposite of that. Like, this tooth is missing 3/4. How can we maintain that other 1/4 of the tooth and keep the tooth healthy for as long as possible? It's great. It's really more widely accepted on the West Coast, in like University Pacific and USC, mm-hmm. where Pascal Magnier and these big guys who kind of founded Biomimetic, David Alleman. I had no exposure to it, and it's kind of eye-opening where if you're exposed to it at an early point in your career, you're able to, apply that throughout the duration of your career.
Yeah,
which is really nice.
Most definitely. Well, it's pretty much everything I have. Is there anything else that you'd like to add?
I don't know. Should I say go Violets, right? That's the NYU team. No, I mean, listen, dental school sucks. No matter which way you slice it, it's hard, it's challenging, it's rigorous, but so is, being an associate, so is being a practice owner. Everything is, going through the trenches. It's never going to be easy. And, when it is, you're doing something wrong or illegal. So be careful and have fun. I mean, there's not a lot of professions where you get to make people smile, make people confident, and, meet all different people from all different paths of life all day long. That's the most rewarding part of the job.
Yeah, that's a great outlook. Well, Dr. Becker, I thank you so very much. It's been great having you on the show.
Thank you so much for having me.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.